Good morning, Sloanies. Hello, my name is Rahul K. I'm MBA class of 2016, here for my 10 year. And despite the weather, we got some 10 years here. Despite the weather, it feels good to be back in Kendall Square. And it is an honor to introduce Professor Erin Kelly, a Sloan Distinguished Professor of Work and in Organizational Studies. She's also the co-director of the MIT Institution for Work and Employment Research. Now, Professor Kelly studies something many of us experience every day, but rarely stop to examine. Why does work feel the way it does? Her research explores how management practices, job design, and employee voice affect well-being, retention, and ultimately organizational performance. Now, her work, it resonates deeply with me. Before joining the organizational development field, I led an employee mental health company and I studied clinical psychology. Now, like many people in my field, I spent years hearing the same version of this question. Can we improve organizational performance without burning out the people that are in those organizations? Now, Professor Kelly's research suggests that the answer is yes. Now, I want you to think about your career for just a moment. Anyone have a guess on how many hours is in the average career? Any thoughts? How many hours? People are doing the math real quick. Yeah, it's like a case study question. In the US, the average career is about 90,000 hours. Now, chances are if you went to MIT, I'm guessing that's going to be closer to 100,000 hours. Now, that is a good chunk of time. In many ways, it's a large part of how we experience society is through our work. Now, as a sociologist, she examines the impact of workplace policies on people and challenges the idea that good jobs and business results are somehow competing goals. Today, she'll share how employee voice can reduce distress, improve retention, and support successful AI-driven change. So please join me in welcoming Professor Erin Kelly.
Thank you. Thanks so much, Rahul. That was wonderful. It was also a little rosier picture than I'm going to paint because there are those possibilities and yet there are real challenges. It's a delight to be with you. I am so happy to be asked and to have a chance to connect with so many wonderful folks. I am less happy to be following Roberto Rigobon. They didn't tell me that, but that's okay. I'm looking forward to sharing a few key messages and exploring the proposition that the way we design and manage work matters for people's experiences on the job, for their health well-being, and so has implications for public health writ large. The good news is there are targeted practical shifts in workplace practices that can improve workers' well-being while also benefiting firms. Now, this does not mean there are always win-wins. It does not mean that win-wins are easy to achieve. And as you'll see, it does not mean that win-wins are necessarily sustained. But it's a reminder that there is space to step back and think about how we organize work. And I'm going to argue that voice initiatives are one such feasible change. By a voice initiative, I mean a structure or a deliberate effort to encourage people to share their ideas and concerns, and to do that from the front line on up, right? And I'm going to also hypothesize and be very clear, this is a hypothesis we're about to start digging in to explore, that voice initiatives can help support more effective AI implementation as well. So in this session, we're going to very quickly look at a framework, spend more time talking about a recent field experiment that my team is wrapping up, studying a voice channel, a voice structure in US fulfillment centers. Not the easiest place to encourage, welcome, and capitalize on frontline workers' voice, perhaps. And then we'll get to this third topic, hypotheses about voice initiatives and AI. I wanted to include this third section, first because I'm excited about it. I'd love your feedback. I'm guessing here in the room, you know much more than I do about the challenges of AI deployment, at least some of you. And I'm hoping this will start a conversation and allow you to share some feedback with me either today or in the future. And then secondly, because it's 2026 at MIT Sloan, and if we don't talk about the implications for AI transformations, then I don't think we get to be in this room. So I wanted to do my little part and catch up on that. All right, so let's talk about the framework. Here we have the classic occupational health framework. It's just a reminder that if we can systematize our thinking about how work is designed, we can find levers, perhaps, to improve that work. So this classic occupational health model offers 3 buckets for thinking about how work is designed. The first is job control, this sense of autonomy, having a say over what you do or usually how you do your work. Absolutely critical. The second is job demands. How fast are you working? How much pressure? Does the load of what you're asked to do match up with the capacity, the resources that you have to do that work? And then the third is social support. Do you feel like people have your back? Can you get help when there's something to learn or when there's something to improve at work? So there's actually a huge literature linking these specific conditions to both physical health and mental health. Job control or autonomy is the clearest story there. But for example, a meta-analysis from a little while ago estimated that 5 to 8% of annual US healthcare costs are arguably attributable, to how US companies have organized work and managed their people. I realized putting this together, I've spent the last 15 years playing around with improving this model and digging into some questions that specifically interest me. The first change is, okay, job control, job demands, support. What does that look like today? What are the aspects of those conditions that are most important today? And so one of my first interventions in this field, I would say, is arguing that we need to pay attention to control or having some say and input over when and where we work, along with how we work. And given today's workforces, this is a critical part of the story of health and well-being. So we advance this concept of schedule control. And then recently, we've been talking about worker voice. So as I've already suggested, worker voice is extending your sense of having a say over your own job to say, do you have some input, some influence, some opportunity to change things about how the organization is working more broadly or how things are unfolding in your workplace? So we see that as an extension of job control to a little bit further away from your own job. The second main intervention to this literature that I've pursued is let's get serious about this evidence. Now, as I said, there's an enormous amount of research, and most of it is either following individuals or just cross-sectionally looking at people who are in different kinds of jobs and the association with their well-being or their health. Not causal, you know? And so we know that the people who land in certain kind of jobs have so many other resources or so many other challenges than other folks. So our teams have worked to test some of these changes with randomized controlled trials, with working with employers to make a specific change and follow the same people over time in comparison to their coworkers in the same firm. The second aspect here is we try to look at multiple outcomes. So work and well-being, I've gotten excited about it. I've spent some time on it. But it also matters to think about what are the implications for a variety of organizational outcomes, organizational learning. You'll see I focus a lot on turnover, and then also productivity and performance concerns. Okay, so that's one. Let's go to two, and let me grab some water. I'm going to tell you about this experiment in US fulfillment centers. So we're interested in fulfillment centers because it's a growing industry, critical part of how our whole economy works. By fulfillment centers, I'm talking about those warehouses that pack and ship goods to our own homes and businesses. You can think Amazon. We don't say who our partner is, but it's not Amazon. But Amazon influences their practices and competes in the labor market for these workers. We're particularly interested in this setting because it provides some decent opportunities to people who do not have college degrees, especially compared to food service, hospitality, retail work. Wages are higher, hours are longer, and people can get overtime, right? So not saying it's an easy job, but it is arguably more comparable to the blue-collar setting of the past. But if you apply the model or the framework that we just looked at, it's tough in lots of ways. Low autonomy, high demands. People are monitored minute by minute at the individual level on their pace of work and what targets they have met. And then also because of the way the jobs are designed and the space is designed, it's hard to have a lot of social support, also a place with a lot of turnover, so you don't necessarily, of course you do build relationships, but it's not sitting around the ping pong table or the beer fridge or anything else that we might imagine, right? So we partnered with this firm, and I'll just tell the little story about how we got in here and what we did. We started hanging out there in 2019, did 100 interviews with managers, with mostly frontline workers and then some managers. Then, of course, COVID hit. We stepped back. They needed to ship out toilet paper to folks and otherwise, deal with this kind of chaotic change in their demand forecast. And when we went back and reestablished the relationship and started exploring in 21 and 22, they were facing a lot of retention issues. Tight labor market, growing industry, lots of competition, people walking out the door, not feeling a lot of connection or loyalty. So working with them, we proposed, let's test this new voice channel that gives people an opportunity to share their perspective, but also kind of sends a signal about the value of people's contributions in this setting. So here's a description in case you're curious about kind of the workforce here. And the intervention or the initiative that we're evaluating is called a Health and Wellbeing Committee, or a HOC. And we came up with this in dialogue with them. It was co-designed with them. We piloted it in one of the fulfillment centers. And the overall goal here at the top in red is actually what we sold to management, what we kind of proclaimed to the employees. It's collaborative, problem solving, focused on workers' concerns, hope that there are implications for the organization as well. You pull together frontline workers or hourly workers called associates in that context. You give them the opportunity to voice, pull together a small group from across departments to do some problem solving, hear concerns, try to implement some changes, and then share that information. Kind of problem solving group, cross-functional team in a way. Now, importantly, in this context, people could already speak directly to management. So they had employee surveys, they had occasional town halls, and so this is kind of an analysis of above and beyond some standard practices, does this participatory approach where peers are seen as part of the problem solvers, does it add something to employees' experience and benefit the firm? I should also mention that hawks are co-led by a frontline worker, the associate co-lead, and a supervisor co-lead, usually a low-level manager. So this is also sending a signal that leadership is found across the building, right? Okay, so what we did was take the 16 available buildings, gather data, and then randomize. And so half of them continued on with their usual practices, and the other half launched a hawk with some light support from us over time. And we're following them before and after over time and able to compare between our treatment or intervention group and the sites functioning as our control group. This is the first experimental study of a voice channel in the US or another industrialized country to our knowledge. So you can imagine it's kind of hard to do a randomized trial and ask people to launch things. There are a couple studies, one in China, one in India, with workforces that had really never been invited to share their perspective with management in any way. But this is a context, where we're looking at that above and beyond. Here's some artifacts from the hawks. You can see they wore these shirts so folks knew to go talk to them and share concerns. There's comment boxes, there's reports on what has been achieved or what projects have been completed. In every meeting, the idea was you hear the concerns and then you talk them through, prioritize them collectively, start to dig into what's going on here and what might we do. Up here, it's hard to see on the left, but it's root cause analysis of why are the fans not ready for the hot weather? Why is our building so hot? And they are digging into what's going on there and how can they divide up the work and figure this out. Here are some other examples of hawk projects. I gotta say, a lot of them are quite operational, but they come to the hawk because they're causing stress and frustration for the workers. Maybe not the music, that's just a enjoyment kind of thing. That happened in multiple buildings. But you can see they range in size, a scope of the project. They range in how much they're about the social dimensions of work versus operational. And this is just a sample. It doesn't include many quick actions. On average, the hawk buildings completed 10.5 action projects in their first year. So, not the most was 23, the fewest was 3. And that leads me to, let's just throw up an equation for fun, right? Get people. I pulled this from the research version of this talk, or the kind of conference version of this talk. Basically, what we're doing is we're looking at the monthly risk of exit for an individual worker using data before and after the hawks were launched in control sites over that parallel period. But my point here is that this is a quite conservative test. It's the average treatment effect of having a hawk in your building. It's not, were you on the hawk? And part of this problem solving, it's not, did you share a problem and then see it be resolved? It's the average effect, including those buildings that frankly struggled with getting things going or sustaining them. So what do we find? Well, first, just descriptively, turnover decreased in the hawk buildings in the year after launch, and in the same period, it increased in the control buildings. Remember, this is the beauty of randomization. We randomized, so the buildings had no say in whether they pursued this or not. They're across different regions. They're across different economic conditions. And so in our model, we can also see the hawk reduced the monthly probability of job exit by 1.3 percentage points, which, given the baseline monthly risk of job exit, means a 20% reduction in the risk of exit. And then on the right, we have just controlling for other predictors of turnover in this setting. Doesn't change at all. Did some robustness checks. We're confident in this finding. You can also see it here. This is an event study. So this is the randomization month. This would be no difference. Before hawks were launched, these buildings had similar risks or similar turnover risks, or individuals in those buildings did. And then after the launch of the hawk, you see this reduction that continues through that first year of data collection. We can also see this more simply, taking everybody who was in the building and just calculating what percentage of them leave. So interesting, we can see these lines are close together at the beginning of the study and then diverge. Also just pretty clear evidence that this hawk is reducing turnover. I will have you read this while I grab some water. Switching from the broad effects on the whole workforce, this comes from interviews with the people on the hawks. And you can see what they value, how proud they are, how they really enjoy being part of the solution, not part of the problem. Okay. What about worker well-being? What we wanted to do, again, was a pretty hard test. We're not looking at work stress. We're looking at global measures tied to mental health. Our primary measure is psychological well-being. This is a clinically relevant measure. You may have been in the doctor's office. You get asked a series of questions. If you hit a certain threshold, then you're considered to have moderate or severe psychological distress. It's not a diagnosis of clinical depression or anxiety, but the doctor would likely say, it's time for you to change something or seek some treatment. Now at baseline, over half of this workforce had that level of psychological distress that would lead to some response from a clinician, versus 19% of the US working adult population. So folks are facing challenges, obviously not only in their workplaces and the rest of their lives. You might have noticed $19 an hour is the average wage in the study period. But psychological distress is worth kind of calling out and investigating here. Our findings are that we see a statistically significant, but admittedly small, shift in psychological distress at 6 months. So the people in the hawk buildings became, on average, less distressed. Now, interestingly, by 12 months, that gap was no longer significant. It's not because the people in the hawk buildings became more distressed again. It's because the control buildings caught up with them a little bit. And there's no change in emotional vitality, which we had in there as this measure of positive psychological well-being. We're trying to think about well-being not just as the negative stuff or the absence of the negative stuff, but as positive, thriving, et cetera. Another interesting finding is that the effects are quite a bit stronger and clearer for men. This was unexpected, but we are looking at subgroup analyses. And what we see is that men in hawk sites had a 57% lower odds of moderate or severe distress than their counterparts in control sites at 6 months. Why would this be? Work and health research and gender and work research had previously found that basically men are more responsive to, reactive to job control or the lack of job control. And we know that unions, involvement in a union or union membership has greater impacts on men's physical health over their life course than on women's. So this makes sense. We can theorize this as being tied to these cultural ideals of being agentic and having efficacy that match up with expectations of how men should be. And our theory, at least, is that the hawk gives people a little more sense of that agency, and that's more psychologically salient for men. So moving to summarize part 2, did the intervention work? I'm going to say yes. If we think of turnover as a behavioral indication of being satisfied with your job, and we think about well-being. Interestingly, did it work from the firm's perspective? We're going to have to dig into this in a couple of parts. But the punchline is that it's very cost-effective, even if we only focus on the turnover impacts and not on the plausible impacts on organizational learning or productivity. So how do we look at this? First, we've got to cost out the intervention, right? So the labor time for taking people off the floor and doing this, and then the small costs of the projects. That comes to this 0.1 to 0.3% of the wage bill. Then previous research has suggested that even in lower wage workforces, an exit costs the firm 16% of the person's annual salary. So those are direct costs like the manager's time to hire to put the job description together, to run the search, to hire somebody, the manager's and coworkers' time to train the people, not even including all of the indirect costs of perhaps lost productivity, lost institutional knowledge, et cetera. So we use this 16%, and using that, there's a huge ROI, 14 to 1. So then I was too nervous to put that up there. So it's like, okay, well, let me figure out how little does the cost of an exit need to be for there to be a positive ROI? And it's basically $425, or 1% of the person's annual salary. So that suggests that this is cost effective. The third thing we did was use Sigma, the firm, their own efforts to retain people. They had made a bunch of distinct wage increases over this period. And so we were able to say, okay, from their data, we can see a $1 increase in wages is associated with a 4.5 percentage point decrease in turnover. So our 1.3 percentage point decrease in turnover is the equivalent of 29 cents of wage increase. But of course, that has a much, much bigger implication for the wage bill and cost. And so it looks to be dramatically cost effective. Now, here's the fun part. Those of you who had me in OP, or those of you who recall your OP, will know, okay, we've got a positive ROI here. Is that the end of the story? No. Cost effective, but not compelling to management. Okay? So it turns out that even with this evidence, hawks have faded away. Yeah. So this is why I had to say, Rahul, you're selling it a little too pretty here. We're keeping it real. So we have done some thinking about what are the challenges that are affecting sustainability. One is the detectability of benefits. We're doing this statistical analysis, looking across all our sites before and after control and treatment. We can see this difference. An individual manager is looking at a few more people leaving or a few people staying for reasons that are hard for them to interpret. So that's just like a kind of system dynamic style kind of how do we interpret the evidence and how obvious is it? And what's our time frame here too? The second is management bandwidth and incentive alignment. So turnover, the SVP of supply chain said turnover is our top priority in the year we launched the study. The building managers have 7 priorities, none of which feel more pressing than reducing turnover, right? So there's the issue that the hawk actually creates more work for the building manager who maybe needs to respond to these proposals and do some back and forth dialogue negotiation informally about what they're going to do. And retention maybe falls from the way down the list of concerns. Relatedly, the people who brought us in, that SVP who said retention is our top priority, he was long gone. 4 years of in-depth partnership. We had 2 SVPs and 3 CHROs in that 4-year period. So the people who were excited about this were not around to encourage or push or provide additional resources to the building managers by the time the findings are evident. I'm sure you all are familiar with this situation, right? And then, arguably, although folks did not say this and often would express a lot of interest in the hawk, it's a cultural mismatch to some extent. These are pretty status hierarchical workplaces. For example, a frontline worker can't, supposedly there's an open door to management, but you can't actually get into the management suite with your badge, right? And so it may be the case that there's some discomfort with even this a limited amount of sharing decisions and hearing that voice. All right, third and last section, and then we'll have time for responses, Q&A, et cetera. We're going from the almost completed project to the project that's launching this fall. And our team has been listening to healthcare workers in various roles. So before I get into this, the team is shifted for this project. It includes 4 great Sloan colleagues. I'll call out Kate Kellogg, who is a leading voice, pardon my pun, on AI implementation and really has been studying AI implementation in healthcare very intensively over the last 6 or 8 years. And then also Zana Buchinka. She is an incoming assistant professor at Sloan. She's jointly appointed with Schwartzman College of Computing. Her PhD is in computer science, and she studies human-AI interaction, and specifically, how do we design tools, systems, and interfaces so that people's skills are protected and their values are recognized within that interaction with the AI. Okay, so we have been listening to healthcare workers. We've done this in 2 ways. First, we got to observe, or I got to observe, 12 days of bargaining between one of the largest healthcare systems and their unions on the topic of AI. So they set up 12 days of roundtable interest-based bargaining to talk about hopes, concerns, strategies, how could workers have a voice at the AI table, and what does that look like? So that provided a lot of interesting information. And then we've been doing informal interviews with this new partner, a regional healthcare system, also involves unionized workers, to hear some of their concerns. So some of the things I've learned thus far, and I recognize there are probably here people in this audience who are implementing AI in healthcare context right now, so you know more than I do on this, but it's been fun to dive in. Of course, there are some fears about displacement or jobs being radically changed. There are concerns specifically about how is the AI system monitoring or tracking everything that I do, and is that going to be used to help me improve patient care or services, or is that going to feel like a form of surveillance and discipline and risky, kind of, interfere with my interactions with folks? So that's there. But I would also say people light up with the idea that this could help address some of the overload, reduce some of the burnout, help make it easier for them to fulfill the mission that they value so much of supporting high-quality patient care and increasing patient access for patients as well. At the same time, even on our very limited fieldwork thus far, we hear about solutions, AI solutions, that have increased workload, increased pressure, or interfered with patient interactions. So I'll briefly share the story from Phil the pharmacist. These are pseudonyms, of course. So Phil the pharmacist works with patients with quite complex care, and he had been pulled in to test a new AI system that looked across the electronic health record and then created alerts if it looked like there were missed medications for a certain condition, or there was something that wasn't following the protocol or the guidelines for best practices, say for diabetes care or heart disease or something like that. But he immediately told us that the electronic health record, that the system was too broad and creating too many false positives and creating this alert fatigue that you may be familiar with, where there's so many flagged cases that you spend all of your time, he said, looking for the needle in the haystack. He tied it to kind of well-known, from his perspective, well-known challenges in electronic health records. For example, if someone is in the ER and there is a mention that we're going to think about heart disease here, or there's a test for a heart attack that's going to be in the record, and the system was therefore diagnosing them or treating them as if they had heart disease and creating all of these flags, right? So from his perspective, it meant he spent his time doing these chart reviews and had less time to interact, to be engaged with patients about the specifics of their case, face-to-face or on the phone there. So obviously, this is something that could be solved, but the point is it was 25%, maybe 50%, maybe 70% down the road of development and deployment by the time the pharmacists were invited in to really test it out, and it was seen as creating new problems rather than addressing existing ones. Barb is a billing specialist, and she handles patient questions and complaints about bills. And recently, her department launched this AI-supported system that can automatically send out letters, which she saw as a huge time savings and amazing. These are not people who are skeptics or critics across the board. And yet, early in that deployment, 1,600 letters went out with incorrect insurance information. So people were getting estimates that certain procedures would be covered at a level that was not the case. And then you have probably not 1,600, but many, many, many folks calling Barb and her team angry, frustrated, confused. And she saw this as something that could have been handled better with a check, with a human in the loop, but that's not what happened, at least in this case. Just to reiterate, these folks are looking for ways for it to work, but they're looking for ways to have input and to have input earlier. Barb said, help me help you. Pull in the billing staff earlier so that they can, specify what needs to happen here. So the central hypothesis of this new project is that if we can have more effective voice practices and make them a routine part of these processes, we can avoid some of the problems of AI implementation and also support job quality and well-being because people have a voice, they're able to share their wisdom, they feel supported in this change process. And so we're trying to figure out it's ambitious, what's the most efficient, effective, replicable way to engage frontline workers in AI so that they can influence AI changes, recognizing that there are lots of other stakeholders and lots of other things to weigh in, but at least they're part of that process. So this team is partnering with a regional healthcare system and with the union that represents their lowest wage workers. We're actually here in phase 0, but we'll start phase 1 early fall. We're going to get in there and understand kind of how are these decisions unfolding now? What are the opportunities for voice now? What would workers like that doesn't feel like too much of a burden? And we're going to work with all of those parties to co-design these engagement strategies. Then we're going to try to do 5 to 10 pilots with this health system and with the support of their union to really test out different ways of engaging folks in this process. Now, again, we're going to have multiple outcomes. So a key one is people's sense of overload, people's sense of voice and agency, but also their well-being and retention. Even for these lower wage healthcare workers, retention is a really critical concern. We have aging workforces, we have strained healthcare systems, and so this is on management's mind as well. And then, really looking at how are things used day to day. Does engagement and involvement support interest in developing skills? And of course, looking at changes in operations, quality, and ROI. After that, our vision is to take some of those lessons and test them in different sectors and industries, gather input, so we can offer a kind of worker-centered, work redesign playbook to figure out how to make this a normal part of the process. That's the goal there. So as I wrap up, and we're going to open it up for questions in 1 minute, I just wanted to say there's a little bit more about this project on the right. The Warehouse Study website has all of our publications and working papers thus far. Plus, we created a guide for managers who might want to launch a hawk, recognizing that if you're not in fulfillment centers, you may need to tweak or customize, but really trying to provide the training and all of the materials for folks who want to explore that. And then on the left, I'll just call out IWER, this Institute for Work and Employment Research, is the context where I do my own work and really, frankly, the reason I came to MIT Sloan. And we have a bunch of resources there. I wanted to highlight some of the recent work of my faculty colleagues in IWER. Emilio Castilla's book came out last year. Paul Osterman has a book coming out on changes in employment relations. And then lots of interesting research on a variety of questions, wages, inequality, manufacturing, as well as worker voice topics. So this is where we are. I did a research version of this talk primarily, but I would be excited to hear how does it feel salient to you, or what questions and critiques do you want to offer? What applications do you see here? Thanks so much, and again, it's a pleasure to be here. I think there's,
Hi, I have a question. How do you compare building strategies within the workplace to create resilience, like the intervention you showed where people put their frustrations into words, versus hiring people who have that capacity? I.e., just hire people who are resilient because they can vent instead of fixing the workplace.
Well, I think it's great to look for people who have a sense of agency and efficacy. Certainly, I think that is important for well-being. In our work, we recognize that systems affect how we show up, too. So I may start out with a sense of agency and positive opportunity to craft a good life, and 10 years in a warehouse may narrow my sense of agency, right? So I don't think of them as really either or. I guess this is the sociologist in me. I think the system affects our sense of self. And also, I'll just say that, part of the design of this kind of field experiment is to say, let's take people who got hired by the same firm. The same firm was looking for the same things, and even in that context, a change in the workplace can change their experiences. Great, thank you. Yes?
Do you have any data, or has there been any work around the work from home time and now people coming back, and what companies are, what they can expect? Because I think there's a big discussion in that.
Yeah.
Thank you.
Thanks, Louise. Do you have a more specific question? Because I actually teach an exec ed 90-minute session on that. So is there something more specific?
I work remote.
Right? Yeah.
There's a big pull on that, and I think there's some dissatisfaction with people going back to work or being required to be there 3 days to 5 days.
Right. Okay, so very briefly, I'll say, if people have a choice in whether they work from home or whether they work in the office, that supports psychological well-being and also retention, right? So part of it is the sense of control or the sense of having a say. Now, of course, you're going to need to coordinate that. You're going to have to say, how does that balance with what the team needs? But when things are mandated, either fully remote, like my husband's at home fully remote and really dislikes it, or full return to office, then you don't have that kind of psychological benefit of having been able to craft it in the way that makes sense for yourself. The other thing I'll say, and happy to follow up with anybody, is there's really no evidence in my close reading of the organization's management and economics literature that 5 days a week in the office pays off. There is evidence that structured hybrid, where you have people have some time at home, some in the office, and you've kind of cultivated the in-office time to feel meaningful and for there to be learning and mentoring and all of those things. That seems to bring benefits in terms of retention and well-being, whereas the push to the 5 full days in the office, the evidence that I have seen does not suggest it's worth the pain and the frustration from the workforce. Yeah? There's someone in the back.
For the Sigma study, was there a look at the overall culture of the organization, either through existing employee engagement surveys or any thoughts on how you could assess that more broadly?
So yeah, we had access to employee engagement surveys. We had a sense of the culture. We weren't able to say, does the Hawk actually change that culture using those measures? But I think the things that were obvious to us are that it's a get stuff done place, right? So everyone, including the front line, really values moving fast and solving puzzles and being sure that all the boxes get on the trucks before they leave. Of course, many people dislike that, and they come in for a few months and then leave. But the long-termers and the culture really was oriented to taking pride in getting things done. And that maybe you're hinting at an important kind of scope condition for this. You've got the message that we value making things happen, and so the Hawk perhaps fits in well there. Thanks. Yes?
Hi, I thought this was great. Thank you very much. I'm curious if you look at the labor pool as a part of the retention analysis in the sense that are these companies hiring people where in a cohort of 100, 25 of those people are just going to leave no matter what? So the retention opportunity is actually maybe smaller than you think. And in fact, the business may actually want those 25 people to leave because they're not really qualified, or they have there's so many external issues that businesses are not well equipped to address that manifest as complaints about the employment environment that aren't. So I guess, do you look at the quality of the pool as a part of these studies?
So we don't look at the quality of the pool formally because that's the beauty of randomization, right? We have it's the same firm, and so you're comparing people dealing with the same pools. They're in different geographic areas. We control for the local unemployment rate, because if you have a lot of choices, the people who stay with you may be different than people who are looking for any job. So I hear you that some turnover is productive turnover, and especially in this period, Sigma had outsourced some of their hiring, which was a cause of frustration too, because people would show up having been hired and never having been in a fulfillment center. And guess what? Lots and lots of those folks didn't like it and left by day 2 or by day 10, certainly. So one thing we did was exclude people in the first 10 days of employment from the study, right? So that we're not getting that churn. And then the other thing is we're comparing all of our sites had that kind of challenge, and so we're looking at the difference in the Hawk sites and the control sites, recognizing that challenge. Yeah. Yes?
Hi, thank you for the talk. What was the reason that the control fulfillment centers were able to close the gap in employee satisfaction after 6 months?
Great question, yeah. We have some evidence on this. You might be concerned that in this kind of experiment, there's contamination. So the employees who are in the Hawk sites are talking to the employees who are in the other sites and actually become more frustrated. That was not an issue for us because these are really geographically distributed sites. But the managers are on these calls with the SVPs where the managers in the Hawk sites are reporting out on what's happening. And so our informal interviews with the management team at the control sites suggested they started paying more attention to employee voice, right? So our reading of it is there's a little bit of spillover from some of these messages from the treatment sites to control sites that may have benefited the people in the control sites. Does that make sense? So for example, some of the control sites started relaunching these monthly lunches with the manager. So that's not a hawk, it's not this participatory, peer-led, but it's sure a new voice opportunity, right? And so that's part of the reality of doing a field experiment.
Hi, thank you
Hi.
so much. So I have a question which is maybe like kind of the opposite of some of the questions that were asked before, is that you mentioned that about when you measure wellness in this particular setting, I mean, in the warehouses, it's about, 50%, versus 19, so it's like significantly worse off. And I imagine because of the nature of the work and the demographics. So my question is there, and I know that's not the point of the study, but
Yeah.
was there interest from the management in this organization broadly to actually understand what are the key drivers of this, poor, mental or whatever wellness, and address actually those drivers, as in actually pay people more or create the environments where maybe women have like some childcare and whatnot, right? Because even if it was interesting to hear, because in this group we always hear how expensive it is to replace like a white collar worker, and especially, but even in this and a blue collar worker, it's so expensive to replace it. Why don't we create a real incentive for people to stay?
Yeah, that's a great question. I think that the HR executives who were part of pulling us in they were open to any kind of mental health support. What I will say that there's a lot of research on wellness initiatives in firms that don't show a real payoff, right? And so I think that's part of why they were open to our message. Let's try to redesign something that's happening at work to see a benefit. They also, at every site in our study, had access to some mental health resources. They called them wellness champions. And so they were also doing, also pursuing some efforts to support people. Usually those get triggered when someone has a recognizable problem, right? And this is kind of, our study is a little bit upstream. In terms of the pay, I think it's a great question. What would be the impact of a pay increase as opposed to a change? I have not yet found a firm that is allowing us to randomize that.
Yeah, if I could ask a question on employee ownership. So I worked for a company which experimented kind of on the cutting edge with giving all employees 10-to-1 voting rights on employee shares and options, same as founders, and also did that for new employees, so post-IPO sort of grants. It didn't really, so the intent was voice, but it didn't, when given a choice, employees would give that voice up for compensation. So in other words, they would convert those B shares to A shares and exercise them. And so is compensation more important than voice at the end of the day?
Yeah, I think that the relative value an individual puts on these things is going to vary. I think what you've pointed to is like an ownership culture is not necessarily easy to achieve either. You can offer the financial incentive, but if people are facing challenging situations or they don't think they're going to be around that long, then it may not play out in the way expected. Yeah, thank you. Okay, yes?
Yeah.
Oh, sorry. You decide, Allison. No, here, I'll go this way.
Because I'm from class of '99, so I'm old alumni, and I wonder if you have a course which provides students with health, physical and mental health knowledge, because if I implement your initiative, I think I have to know much about health knowledge itself. So how to what to eat, what to do exercise, or how many hours to sleep, or something like that. Do you have such a program currently?
Yeah, thanks for that question, and thank you all for being here. I know people are going to head out in a second. I have not been involved in that kind of what I would call health promotion. I would say we invest a lot in helping people be healthier, and we have a lot of workplace investments in those. The evidence is that the people who want to be healthy find it at work, or find it in the community, or find it at their doctors, right? And so the workplace investment in that may not pay off as much as we think. But I think the broader question here is, where does this fit in our management curriculum? You know, where do we fit this in? We do have an interesting course that's quite popular now called People and Profits that has different opportunities, including different ownership structures, other kind of ways of thinking about how work affects individuals, communities, and the firm, of course, itself. Thank you so much.